Good afternoon, everyone. I'm Dr. Aajay Shah, and today we are bringing this another Facebook Live. This is our scheduled Facebook Live every Sunday at 4 o'clock. And every Sunday at 4 o'clock in the afternoon, Eastern Time, we talk about how to prevent and reverse diabetes. So, this is our second episode. We did it last Sunday also. I also gave a 4 hour talk on diabetes about 3 weeks ago. That video is already on YouTube. So if you have not watched that video, please watch that video. It's very comprehensive talk. It mostly talk about type 2 diabetes, why type 2 diabetes happens, how we can reverse it, how we can treat it, what are the goals, what are the complications. So again, make sure you watch that video. Today we're going to kind of abbreviate the whole talk in about half an hour. So we can take half an hour of questions on this Facebook Live. So I'm going to start with the slides for about half an hour. So again, diabetes, I call it a raging pandemic because it's affecting the whole world now, not just America, but India, China, everywhere in the world. And it's raging because the incidence of type 2 diabetes is exponentially going high every year by year. We'll talk about that. Again, this seminar is not going to be giving you any medical advice. This is truly for education purpose. So if you have diabetes or if you are pre-diabetic or if you're trying to prevent the diabetes, make sure you stay in touch with your doctor. So in terms of prevalence in America, 12 to 14% of population has diabetes. 95% of this diabetes are type 2 diabetic. If you look at the adults, I'm going to admit somebody else. If you look at the adults, almost 15 to 20%. And if you look at the Medicare population, almost 25%. If you look at the African Americans, after age 65, almost 25 to 30%. So again, a very, very high prevalence of type 2 diabetes in America. In the world, it's the same thing happening. So again, this is the prevalence in 94 in America. Most states were actually less than 6%, less than 4%, and now it has almost 10% or more. West Virginia has the highest risk of type 2 diabetes, almost 14 or 15%. So again, type 2 diabetes in the last 30 years almost has quadrupled. When I came to this country, it was only about 5-6%. Now it's about 11 to 12%. So there are five different types of diabetes. Type 1 is the diabetes where pancreas, the islets, beta islet cells in the pancreas stops making insulin. So type 1 diabetes always will require insulin. Type 2 diabetes, which is the most common type of diabetes, is where actually insulin resistance happens. And we'll cover insulin resistance in very detail as we go in the slides. There's a type 1.5 diabetes where adult starts with insulin deficiency and they behave like type 1 diabetes, but it typically starts in adult after age 30, 35. And there is a gestational diabetes, and a pregnant woman develops the diabetes. Let's look at the type 2 diabetes. Type 2 diabetes is almost 90 to 95% of all diabetics. So we'll cover type 2 diabetes extensively today. The major reason for type 2 diabetes is obesity. Any body mass index above 30 is obesity. In America, it's almost 42%. If you look at the recent data from 2020, 42% Americans are type 2 diabetic. And projections are that by 2030, 50% Americans will be obese. That's very alarming, very concerning. Obviously, overweight also predisposes you to having type 2 diabetes and prediabetes. And overweight is any body mass about any BMI about 25. Sedentary lifestyle plays a role also. People who are not physically active also have high risk of diabetes, type 2 diabetes and prediabetes. Certain dietary factors, including eating a lot of processed food, a lot of calorie dense food, red meat, high saturated fat food, high simple carb food, all predispose you to having pre-diabetes and type 2 diabetes. High blood pressure also has been shown to cause type 2 diabetes. And actually, high blood pressure is almost chicken and the egg. Which one comes first? people with diabetes many times develop high blood pressure, and many people with high blood pressure develops diabetes. Many times high blood pressure happens because of insulin resistance, which we'll cover in detail. So in terms of our dietary factors, in 1970 versus 2010, we are eating about 500 more calories compared to 1970. And a lot of this calorie mostly come from grain products, and most of these grain products are simple grains, processed grains, like white rice, white flour, and that's the reason this type 2 diabetes is happening. We are also eating a lot more fat and lot more oil, lot more vegetable oil in our diet. So those are the two main reasons our caloric intake has gone up. Those are the reason obesity has really big time gone up, and that's the reason type 2 diabetes also has gone up. Other risk factors including having low HDL, which is a good cholesterol, and high triglyceride, which is the fat in the blood, and those reasons also can lead to type 2 diabetes. People with metabolic syndrome, which we'll cover in a second, also can predispose to developing type 2 diabetes. Metabolic syndrome is the one where you have a high blood pressure, low HDL, high triglycerides, waist diameter above 40 for male and above 35 for female, and blood sugar above 100. If you have 3 out of the 5 criteria, then you are considered to have a metabolic syndrome. So you should know all the 5 criteria. When you have a chance, look at my diabetes talk, which was recorded about 3 weeks ago. It's already on YouTube. That talk extensively covers metabolic syndrome or pre-diabetes. All of us should know whether we are pre-diabetic or not, because if you are pre-diabetic and if you start making lifestyle changes, you can actually prevent the type 2 diabetes. There are enough studies done. There was one study done in the UK where actually it was a diabetes prevention project where actually people who change the lifestyle, the prevention of diabetes was almost 50 to 60%. So again, lifestyle changes will prevent going from pre-diabetes to diabetes. Certain ethnicity also predispose you to having type 2 diabetes, particularly American Indians, Indian Americans like myself, African Americans, and Hispanics. So if you have any of this ethnicity, make sure you watch out because you're very high risk of developing type 2 diabetes. Other risk factors including polycystic ovarian disease. So if a woman is suffering from polycystic ovarian disease, she's also at high risk of developing type 2 diabetes. A woman who had a gestational diabetes also in the future is at risk of developing type 2 diabetes. If you have a family history of type 2 diabetes, you are at 3 times more risk of developing type 2 diabetes. But in my opinion, a lot of this family history is mostly because of the lifestyle we share, the habits we share, the behavior we share. It's not typically because of a gene. So again, if your family history is typically because the food you eat, the lifestyle you have, the kind of activity you do. So again, family history is important, but it's mostly important because that's how our lifestyle is. Age we'll cover in a second. As we get older, we are at higher risk of developing type 2 diabetes. Having a high visceral fat, which is typically the fat around your belly, is also puts you at high risk of developing type 2 diabetes. Having low muscle mass also predispose you to having type 2 diabetes because muscle is the biggest utilizer of sugar. And if you have a low muscle mass, you will typically will have type 2 diabetes. And aging is a major thing to talk about. As we get older, we start to lose muscle mass. Our body fat percent starts to go up. We start to have more fat cells. We have a less efficient mitochondrial function. Typically, we are less physically active. We also start to lose beta islet cells function and mass also. And many times we have poor diet as we get older because of many times we are not cooking and a lot of ready-made food, a lot of microwave dinners start to happen as we get older. And that's a reason many times after 65, type 2 diabetes becomes very common. Diabetes is a very expensive disease. It costs $327 billion per year to America. Medicare spends about $100 billion for taking care of diabetes, mostly type 2 diabetes. And the cost of diabetic patient is almost 3 times more than non-diabetic patient. And average, a diabetic person will spend about $100,000 in his or her lifetime to take care of the diabetes. So again, let me repeat that number. A diabetic patient, typically a type 2 diabetic patient, will spend $100,000 to take care of his or her diabetes during the lifetime. So very expensive disease. Let's go through mechanism of type 2 diabetes. Typically, it's because of the fatty acids in the cell. Essentially, fat in the cell will cover. I'll show you the picture. This is the most accepted theory of type 2 diabetes. There's also a role of inflammation, chronic inflammation, oxidative stress, and many times because of certain factors, beta islet cells in pancreas starts dying off. And with combining all this thing, type 2 diabetes happens. The first step in development of type 2 diabetes is a fatty acid entering into muscle cell. So people who are obese with a lot of fat cells, they keep secreting fatty acid from those fat cells. And people also who eat a lot of saturated fat, those fatty acid gets into muscle cell. So the first defect is fatty acid in the muscle cell. And when this fatty acid gets in the muscle cell, it changes the insulin receptor, and insulin does not connect properly to the cell. And eventually that leads to glucose not able to enter the muscle cell. So first defect is the insulin resistance into the muscle cell itself. Once the muscle cell cannot produce glycogen because the sugar cannot enter the cell, though that sugar eventually funnels back to the liver, and because of its circulating fatty acid and the sugar, liver starts to also get fat in the liver cells, and that's where liver insulin resistance happens. Once insulin resistance happens in the liver, diabetes actually really speeds up. Many times this fatty acid also gets deposited into the beta islet cells of pancreas, and beta islet cells become less efficient and start secreting less insulin. Eventually, beta islet cells also develop apoptosis, means those cells start dying, and eventually efficiency starts happening even in type 2 diabetes. So again, in my opinion, there is a we call twin cycle hypothesis, but in my opinion, this is almost like a quad cycle hypothesis where muscle become insulin resistant by fatty acid entering muscle cells, and then liver become insulin resistant by circulating glucose as well as fatty acid, and then pancreas become insulin resistant, and fat cells have their own role and their own function. All these things have been described in my talk at very length. Today, I'm just covering quickly for 20, 25 minutes, so that way we can take live questions. But again, if you have not watched my 4-hour diabetes talk, please watch. That's one of the most comprehensive, most detailed talk. You can learn everything about type 2 diabetes in that talk. You don't have to read any book. Just listen to that talk and you'll be able to learn everything about type 2 diabetes. And again, this is a very famous picture from Dr. Neil Barnard, where you can see the yellow fat globules in the cell, and those leads to insulin not able to attach to the cell insulin receptor properly, and that eventually leads to not have the glucose enter the cell. And this is the initial defect in the muscle, where fatty acids or fat in the muscle cell develops insulin resistance. So again, if you sum it up, the mechanism of type 2 diabetes, is fat where it does not belong, fat where it does not belong, because fat belongs into fat cells. Fat does not belong into muscle cell, fat does not belong into liver cell, fat does not belong into pancreatic cell, fat does not belong into even the brain cell. So again, fat where it does not belong. So if you understand this one simple slide, fat where it does not belong, you will understand the mechanism of type 2 diabetes. Again, this is a very busy slide. I'll quickly read, just listen to it. Insulin resistance is the underlying mechanism for type 2 diabetes. So insulin resistance obviously is seen in type 2 diabetes, pre-diabetes, even in type 1 diabetes, patients or people who are obese can have insulin resistance. Even type 1.5 and obesity can lead to insulin resistance. Insulin resistance can also lead to high blood pressure, atherosclerosis or heart disease and heart attack, can lead to high cholesterol, obviously obesity, fatty liver disease. Matter of fact, fatty liver disease now is the commonest reason for cirrhosis and for liver transplant in America. I was just talking to somebody earlier this morning, person who has diabetes also has a fatty liver disease. So again, fatty liver disease is a major concern when person is obese and has insulin resistance. Insulin resistance also can lead to chronic kidney disease, and many patients unfortunately gets on dialysis. It can also lead to polycystic ovarian disease in women. It can also lead to Alzheimer's disease. Matter of fact, Alzheimer's disease is called a type 3 diabetes because neurons in brain develop insulin resistance and they start functioning not properly. Glucose cannot get in the neurons, and then you start having memory loss, cognitive dysfunction. So again, Alzheimer's disease is a part of the insulin resistance. It can also lead to neuropathy. Many people develop neuropathy in their feet and they cannot feel when they step on a nail or sharp object, and that can lead to many injuries. And because they have also poor circulation, that sometimes many times lead to amputation. So again, very, very concerning when a person has insulin resistance. Insulin resistance also can cause blindness. I've seen many patients who unfortunately have lost their vision. Matter of fact, I'm helping one person who also has lost the vision, has a long-standing diabetes. Uh, and also insulin resistance and type 2 diabetes can lead to erectile dysfunction. So again, very, very concerning effects of insulin resistance. By all means, insulin resistance should be prevented. It definitely can be reversed. We'll talk about it in a second. So how can we make the diagnosis of diabetes? Diagnosis is made by fasting blood sugar above 126. In 2003, I believe, the diagnosis was up to 140 sugar. Now the sugar is 126. But in my opinion, and I have covered that extensively in my talk, in my opinion, this 126 or below is still not healthy. Any blood sugar above 84 actually is unhealthy. Right now, we define pre-diabetes as a sugar above 100, but in my opinion, any sugar above 84 fasting is not healthy. I have discussed that in my talk, so please refer to my talk also. When you look at the A1C, which is the 3-month average of sugar, any A1C above 6.5% is also called diabetes. Any A1C between 5.7 and 6.5 is pre-diabetes. But in my opinion, and again, I have covered that in my talk, any A1C above 4.9 is actually can lead to many chronic issues. So again, try to keep your A1C the lowest you can, which we will cover in a second, what A1C goal you should have if you have diabetes. So again, when we look at the type 2 diabetes particularly, the primary goal in type 2 diabetes is to reverse the insulin resistance. Many times, many doctors, many patients, when I ask them, what is the goal of treating a diabetes? Many times they say that I want to lower my sugar, I want to lower my A1C. But in my opinion, that's a secondary goal. The primary goal is to reverse the insulin resistance. The secondary goal is to control the sugar and control the A1C. And tertiary goal, obviously, is to prevent the complications. So again, primary goal is to reverse the insulin resistance. And the reason I want all of you to understand that the primary goal is to reverse the insulin resistance, because to reverse the insulin resistance, you need to lower the fatty acid. Let me end. To reverse the insulin resistance, if you remember the mechanism, you need to bring the fatty acid out of the muscle cell, out of the liver cell, out of all the cells in the body. So that's how you're going to reverse the insulin resistance. That means losing weight, lowering the fat in the fat cells, and also not eating a lot of saturated fat. And the reason I want you to understand that reversing insulin requires getting the fatty acid out of all the cells is because if you look at certain type of diet, which has been lately promoted, particularly keto diet, but a lot of meals include saturated fat. Matter of fact, in keto diet, carb is only about 5 to 10%, and fat is almost to 60%. So if you understand the mechanism, how can keto diet actually make the insulin resistance better? In my opinion, keto diet may bring your sugar down, may bring your A1C down, because obviously you're not eating that much carb. So artificially your sugar and your A1C may be lower, but deep down, insulin resistance can be keep getting worse. Actually, matter of fact, people who are on keto diet, when we give them any small amount of carb, the sugar spikes up. And there are even mice studies where mice were fed with a keto diet, and they actually developed a higher amount of insulin resistance, and their insulin sensitivity went down. So again, keto diet may control your sugar, may bring you down your A1C, but deep down, insulin resistance is still persisting and is still many times getting worse. So again, keto diet, in my opinion, is not the answer. Obviously, I want all of you to be your own judge. Read more about it, watch YouTube videos. There are a lot of books on keto diet also, but in my opinion, keto diet is not the answer to type 2 diabetes. Uh, so again, when we start following this plan, once you look at my 4-hour lecture, and once you start doing the lifestyle changes, your sugar will start coming down very rapidly. Matter of fact, I have a lot of patients now whose sugar starts coming down in 2 or 3 weeks. And many times we have to cut down their insulin. Many times we have to stop their insulin. Many times we have to stop some of their oral medications. So again, if you are going to start following this lifestyle from today after listening to this lecture, or if you watch my 4-hour lecture, make sure you stay in touch with your doctor because your sugar will start coming down rapidly. Also, your blood pressure may start coming down rapidly too, to make sure that you monitor your blood pressure very closely. Lifestyle is a very powerful treatment, and people who start healthy lifestyle, whole food, plant-based, which we'll cover in a second, they start changing their diabetes and blood pressure very rapidly. Okay, when it comes down to type 2 diabetes, many doctors still believe, and many people, many patients still believe that the type 2 diabetes is a progressive disease and cannot be reversed. But that's not true. Type 2 diabetes can be reversed in very short time, and it definitely can be prevented if you do certain lifestyle changes. So again, don't listen to doctors. If they say that diabetes just keep getting worse, you need to keep adding more medications. So again, let me repeat, the primary goal in type 2 diabetes is to reverse the insulin resistance. Secondary goal is to control the sugar and lower the A1C. And obviously, tertiary goal is to prevent the complications and maintain the lifespan. An average diabetic lives about 10 years less than a non-diabetic. So again, the tertiary goal would be to prevent the complications, which we'll cover in a second, and also maintain the lifespan. So when we start managing diabetes, A1C goals, blood pressure and lipid goals, or cholesterol goals, when we look at the A1C goals, in general, the recommendation is to keep the A1C 7 or below. But in my opinion, that's kind of a mediocre goal. That's kind of a cop-out goal, because the reason 7.0 A1C is recommended, because when you try to go below that, many times hypoglycemia or low blood sugar level happens, and many times patients develop complications. And for that reason, A1C of 7 has been recommended. But in my opinion, if you do lifestyle changes, and if you are able to get off all your diabetic medications, your A1C goal does not have to stop at 7. You can actually keep going down all the way up to 5.7 and reverse the diabetes completely, or even you can still keep going down and make it below 5.2, 5.1, and get down as low as possible. But again, to do that, you have to be off all your diabetic medications so that your sugar will not become hypoglycemic. So again, if your doctor tell you that we will keep your A1C goal 7, if you're doing aggressive lifestyle, and if you're able to get off most of your diabetic medications, then you should be able to lower your A1C goal actually way below 7. In terms of the blood pressure goal, typically blood pressure goal is 120/80. Sometimes we keep the blood pressure slightly high, particularly if the person has a dizziness or lightheadedness or standing up, and how we call autonomic dysfunction. But typically we keep the blood pressure 120/80. We use certain type of medications when person has diabetes and has blood pressure same time. So talk to your doctor what kind of medication you should be on. Cholesterol goals are also very important. We need to keep LDL, the bad cholesterol, below 100. And if a person already has a heart blockage, then that LDL needs to be kept below 70. You probably will need to be on a medication called statin. So talk to your doctor to see whether you qualify to take statin type medication or not. There are certain blood tests which every diabetic should get it done periodically. Obviously, fasting sugar is very important. A1C, which is a 90-day average, is very important. Also checking liver enzymes to make sure there is no fatty liver. Also checking kidney function with a we call creatinine to make sure you're not developing kidney failure or kidney dysfunction. Also checking we call urine microalbumin, which checks for the protein in the urine. So again, all those labs tests become very important. They've been described in my other lecture, for 4-hour lecture. So just watch that lecture. Again, let's talk about diet now. Actually, let's talk about diabetic medications. I have covered those medications in my other lecture, but to give you just one line summary of diabetic medications, there are some newer great medications now available. So make sure you talk to your doctor that do you qualify for some of the newer medications. Some of the newer medications actually have shown to benefit out of the heart complications, particularly heart failure. Even it can even help to lower your blood pressure. So make sure you talk to your doctor about some of the newer medications. Typically, I'm not a big fan of medicine called sulfonylurea but it's still been prescribed. So make sure you stay in touch with your doctor, either your primary care or your endocrinologist, to see whether you qualify for some of the newer medications. The newer medications actually right now are not generic. That means they cost more, but in the long run, they save many complications, and it's worth considering some of the newer medications. Uh, when it comes down to type 2 diabetes, simple thing is type 2 diabetes happens is because what we eat. So therefore, treatment will be also what we eat. So again, we'll talk diet extensively. In my opinion, type 2 diabetes, the major role of treatment is diet, what we eat. So let's start with the diet. Caloric excess is a major issue. Like I just covered earlier, that average American eats about 500 more calories compared to 30, 40 years ago. So we need to definitely cut down on our calories. That's the number one recommendation. If your body mass index is about 25, you need to create about 500,000 calorie deficit per day. That way you will lose about 1 to 2 pounds per week. So again, you need to cut down on the calorie. Particularly if you have a body mass index, if you are obese, above body mass index about 30, you need to definitely cut your calories, minimum 500 per day, possibly 1,000 calories per day. That means you should be eating between 1,200 and 1,500 calories per day. Typically, I don't recommend going below 1,200, but there are some studies, there are some data where people were given a very low calorie diet, like 800 to 1,000 calorie, and their type 2 diabetes was reversed very quickly. But most of the time, I recommend my patients eating about 12 to 1,500 calories and burning about 2,000 calories per day with physical activity. So again, goal for body mass index, if you have type 2 diabetes, is definitely below 25 and preferably below 22. In my opinion, if you have type 2 diabetes, and if you bring your body mass index to 22, there are very high chance that you reverse type 2 diabetes. So make sure you calculate your body mass index. There are online calculator available. And if you have any questions, just go ahead and ask me questions on my Facebook page, and I'll definitely answer every one of them. For Indians, for Asians, like person like myself, body mass index of 20 to 21 possibly may be ideal. So for Indians, don't settle for body mass index of 25. Bring your body mass index below 22, even 20 or 21. If you're diabetes, definitely for Indians, body mass index of 21 is ideal. When it comes out to diet, we should be eating whole food plant-based diet. Whole food plant-based diet. That means eating raw and cooked vegetables, almost 1 pound of each every day, 5 servings of food, some flax seeds to get the omega-3, and obviously some nuts, particularly if your body mass index is below 25. If your body mass index is above 25, I typically don't recommend nuts because nuts are very calorie-dense food and it packs a lot of calorie. But the key thing is whole food, plant-based diet with 1 pound of raw vegetables, 1 pound of cooked vegetables, 5 servings of food, and 1 to 2 tablespoons of a flax seed. Definitely no added sugar, no added sugar. I pretty much said that if you are diabetic, get all the sugar out of your house. Definitely eating only whole intact grain. Whole intact grain is also very important. And I have a separate talk under my 4-hour talk. I call it grain hierarchy, where all different type of grains we eat, but we should be eating intact grain. In terms of the macro ratio, I highly recommend to have a complex carb, about 70 to 80% of diet, fat 10 to 15% of diet, and protein about 10 to 15% of diet. So again, when you look at some of the blue zone diet where people live long, people live healthy, their ratio typically is carb of about 70 to 80%. If you look at the keto diet, which I described earlier, fat is about almost 65%, and carb is less than 5, sometimes less than 10%. In my opinion, that's not the diet for type 2 diabetes. That actually is not the diet for any person, in my opinion. So again, if you are type 2 diabetic, bring your fat less than 50%, ideally less than 10% if you can. Definitely have a saturated fat less than 10 grams per day. Again, I don't recommend keto diet at all. So again, if you want to reverse type 2 diabetes, you can do it in 6 weeks. There's a book called It to Live book, It to Live. It's book by Joe Furman, and that book has a page 216. That's like my most favorite page for last 3 years. I've been giving copy of that page to all my patients, particularly who are type 2 diabetic. If you follow page 216 in It to Live book, you can definitely reverse type 2 diabetes in 6 weeks. I very highly recommend. I've given talk on that book in my long diabetic talk. Please refer to that talk. Again, if you reverse type 2 diabetes, goal is to lose about 15% of your body weight. That means if a person weigh about 200 pounds, losing about 30 pounds, and losing about 1 to 2 pounds per week is ideal. I don't recommend losing more than 2 pounds per week. So start eating 500 to 1,000 calorie less every day, and you will start losing 1 to 2 pounds per week. Again, bringing your body mass index to 22, you have a very high chance of reversing type 2 diabetes. Definitely people who have a big belly, big abdominal fat, big visceral fat, people who have waist diameter 35 for Indians, 40 for American male, definitely should lower the visceral fat. Again, this is a simple slide, but this slide proves that people who have type 2 diabetes or any diabetes, A1C below 7 is achieved only in 50% of people. That to me is not an acceptable number. We should be achieving our A1C goal 80, 90% of the people. Blood pressure goal is also only achieved in about 50% of people, and the cholesterol goal is also achieved in about 50% of people. So again, all three goals are very important: A1C, blood pressure, and cholesterol or LDL, the bad cholesterol. We don't achieve more than 50% in terms of the lowering the numbers. And typically all three goals are less than 10%, less than 15%. So talk to your doctor. How can you achieve more goals on your A1C, on your blood pressure, and on your LDL, the bad cholesterol? Diabetes and microbiome is a very hot topic. I talked almost 15, 20 minutes in my long diabetic talk. Please watch that video. But again, we all need very healthy microbiome. Microbiome means the bacteria which resides in our intestine, typically in our colon. And if you have a healthy microbiome, you will digest, or those bacteria will digest soluble fiber and make more small chain fatty acid, which actually help to increase the insulin sensitivity. So again, having a healthy microbiome is very important. I want to cover about 2 minutes on Indians and Indian Americans and diabetes. In India, diabetes is almost 11 to 14% in the urban area. Rural area is about 7 to 10%. And in South India, some of the cities have as high as 20%. In South India, some of the cities above age 50, almost 40, 50% chance of type 2 diabetes. In Indians, typically we have low pancreatic islet cell number. That means we have less beta islet cells, and also we have low function of beta islet cells. In Indians, typically we have low muscle mass and have a high body fat percent for the same BMI. So for typical Indian male like me, if my body mass index is 25, and if an American white person has a body mass index of about 25, typically I have much less lean muscle mass. And that's the reason insulin resistance happens. And that's the reason type 2 diabetes is very common. As Indian, we have more visceral fat per body weight. And that may be the reason for developing type 2 diabetes. As Indian, in India particularly, many of us are vegan and vegetarian, but we definitely eat a lot of processed food, a lot of dairy, and both have shown to cause type 2 diabetes. As Indian, in India and even in America, we are much physically less active, particularly in the urban area, and that may be the reason developing type 2 diabetes. So again, India is becoming type 2 diabetes capital of the world. Some of the South Indian cities are so, every other person after age 50 has diabetes. So again, if you are from India or if you are Indian American, watch out, very high risk of developing type 2 diabetes. Let's quickly cover the complications. Heart complication is the most common complication. All diabetics typically don't die from the sugar. They typically die from heart attack or stroke. So again, very important to know that it's the heart complications and stroke complications which can lead to complications and death. And for that reason, controlling blood pressure, controlling cholesterol becomes very important. Many other complications, including developing a vascular disease or blockage in the leg arteries and developing ulcer. And because of neuropathy, many times people don't feel the sensation on their feet, and that leads to many injuries, and that can lead to sometimes even amputation. So again, very important. like we covered, a lot of people with type 2 diabetes, even type 1 diabetes, will develop blindness. A lot of people will have a kidney failure and will require dialysis. Fatty liver also we cover, very common, and that can lead to cirrhosis. Actually, all diabetic, particularly type 2 diabetic, are at very risk of developing cancer also. Many cancers, including breast cancer, liver, colon, uterine, they all are at very high occurrence when people have type 2 diabetes. A lot of infections happen in type 2 diabetic, and type 2 diabetic typically have a much lower immunity. Gout, where uric acid level goes up and people develop joint arthritis, gouty arthritis, that's also very common in type 2 diabetes. A lot of skin tissue happens also in type 2 diabetes. So again, I covered about 30, 40 minutes of type 2 diabetes mostly. But there are some good resources. The resource I like is called Mastering Diabetes. This is by Cyrus Gambata. He has written actually a great book called Mastering Diabetes. I highly recommend if you have type 2 diabetes. Dr. Neil Bernard also has many books on diabetes, worth looking into his YouTube videos and his books. Dr. Joe Furman, my favorite lifestyle physician, he also has books on diabetes. Actually, his book, his book is End of Diabetes. Very excellent book. He also has many YouTube videos. So watch out those videos. I will start the slides right now and we'll take some questions. So again, I hope you enjoyed this talk. This was a quick summary of my talk, which I've given 3 weeks ago. Any questions so far? Let me tell you a story about a person. I'm actually helping a person right now for last about 2 weeks. That person has actually lost extensive weight in 2 weeks. Insulin requirement has gone down almost 1/4 now. That person was on 200 units of insulin, now is only on about 40 or 50 units of insulin. So again, lifestyle changes can make a tremendous impact if you have type 2 diabetes. Anybody has any comment or questions?
Yeah, this is Ashwani Garg, and I'm family doctor.
Go ahead, please.
This excellent talk, and I just wanted to say hello. And
yes.
This plan is absolutely solid. But you know what I wanted to emphasize in the beginning, it's so important to follow the plan 100%. You know, there's no moderation. And then some people are able to moderate, you know, at the end of it if their A1C drops to totally normal. But yeah, that Dr. Shah is so good with helping people along the way, intensively.
Oh, thank you. No, I think I will say that Dr. Garg, in my opinion, is one of the few primary care physicians in the whole country who 100% believes in lifestyle. And I think his patients absolutely not only get reversed the diabetes, but many times actually go out and tell other people that the best way to take care of type 2 diabetes is lifestyle change. And like Dr. Garg said, that in the beginning, you have to go 100% total lifestyle change. And the person I was referring to, that person has overnight gone to the whole food plant-based diet, no oil, no animal products, no dairy. She has lost about 15 or 16 pounds in 14 or 15 days. Now, matter of fact, she has been doing actually some fasting with me. So I think initially when you start with type 2 diabetes, if you go very strong, you can reverse your type 2 diabetes as quickly as 1 to 2 months. And your insulin actually can go off within 2 to 4 weeks. Some of the people who I've seen, when they go whole food plant-based and they cut the calories in the diet, their insulin actually rapidly start going down, and many times they're off insulin in 2 to 4 weeks. I think that's a great point that the Greg made.
Thank you. It looks like, Dr. Shah, you have a question in the chat box.
Let me see. Oh, so the question is, no matter what I do, I don't lose weight. I've been at the same weight since the last 10 years ago. So the question is that that person is not able to lose weight no matter what they do. I think obviously there are a lot of factors when it comes down to not able to lose weight. Number one factor is the diet. Sometimes we probably are eating a lot more calories than we realize. We definitely are eating a lot of oil. Particularly if we are Indian people, we definitely have a lot of dairy in our diet. So if person wants to lose weight, going whole food plant-based, that means, let me repeat what I earlier said, 1 pound of raw vegetables, no oil, 1 pound of cooked vegetables, no oil, 5 servings of fruits, 2 tablespoons of flaxseed, definitely no oil, avoiding all dairy, avoiding all animal products. If you do that, somehow everybody gravitates towards what the ideal body weight is. Now, obviously, some genetics play a role in terms of the body weight and obesity. And if you are going to have a body mass index of, let's say, 25 genetically, you will stop there and you will not lose any more weight. But let me tell you, if you eat the type of diet I described, you are getting all the micronutrients, you're getting all the phytochemicals, and even if you stop at a body mass index of 25, you probably will be healthier than many of the people whose body mass index is 25 and not eating healthy. So don't worry what weight you come down to. Just start eating 1 pound of raw vegetables, no oil, 1 pound of cooked vegetables, no oil, whole intact grain. And many of you probably heard about a dietitian called Brenda Davis. Her name is Brenda Davis. And her policy is that she eats 1 pound of raw vegetable, 1 pound of cooked vegetables, 5 servings of fruits, 2 tablespoons of flaxseed. And that she adds up all those calories. And those food are typically low calorie dense food, typically anywhere from 100 calorie per pound, 500 calorie per pound, 3 to 500 if you have fruits. And then whatever calorie is left, she takes the intact grain. If person is athletic and requires 2,500 calories, may need more grain. But if you are trying to lose weight, and if you are not very physically active, then eating 12 to 1,500 calories from vegetables and fruits, you can achieve that. And if that's the case, you can eliminate the grain completely and your weight will start coming down. So again, to answer that person's question, if you eliminate grain completely and eat about 1,200 to 1,500 calories per day, mostly from vegetables, fruits, and 2 tablespoons of flaxseed, then you probably will start losing weight. I definitely don't recommend people losing more than 1 to 2 pounds per week. And I'll be interested to see how that person does, and she can come back in a month again and see how the response was.
Yeah, and just one more thing to add, with thyroid, it's an extra uphill battle. So one thing I found is the leg muscles have the biggest, muscle group in the thigh. So that means like incline, walking, incline running. That is a very effective way of weight loss. Daily 1 hour per day. If it can be, for example, 4 miles, that's a great way for the weight loss as well.
Yeah, I think I agree with Dr. Garg that we should definitely add physical activity to the diet. I think diet is must, but physical activity is also as important as diet. We should be doing both. So actually, physical activity, the benefits are significantly high, even if you are not losing weight. So just start exercising and you will start enjoying the cardiovascular benefit, the longevity benefit, your type 2 diabetes will start getting worse. So definitely exercise. And again, when we talk about the lifestyle, it covers all 6 pillars. And I've given separate talk on all 6 pillars, but what we eat, how much physically active we are, how we sleep, what kind of substance abuse we have, including alcohol, what kind of stress management we are doing, and what kind of social relationship we have. So I think to lose weight, all 6 pillars are important, and we should be doing all 6 pillars. Any other comments or questions? But I appreciate Dr. Garg coming on. I think that's an honor because I always admire him. I've seen him personally, I think twice now. So I think that's a great feeling that he came on. He was
Thank
nice
you so
to
much.
stay for the whole talk.
Thank you.
Thank you, Dr. Shah. It's very nice, good information. I think Aftab asked the question in the chat.
Let me see. Yes. So there is a question from Aftab that I have diabetes for last 18 years, but my PCP has never suggested doing C-peptide or fasting insulin level. Do you suggest doing it now? I started a whole food plant-based diet 3 days back. Please advise. So I think when we look at the C-peptide level, C-peptide is a lab test, is a blood test, which actually reflects how your beta islet cells in the pancreas are functioning. Because insulin itself has a very short half-life, so checking insulin level sometimes doesn't work out properly, but C-peptide has a longer half-life, so it's easier to check C-peptide. If your C-peptide level typically is, I think, about 3 to 5, again, I'm not the expert on it, but if your C-peptide level is about 3 to 5, that means you have an intact pancreatic function. That means if you do the whole food plant-based diet, and if you lose weight, you have a very high chance of going off insulin completely. So again, if your C-peptide is above 5, you have a very high chance of going off insulin completely. So I agree with you. I think if you are type 2 diabetic, and if you're on insulin, and if you want to go off insulin with losing weight, eating the whole food plant-based diet, make sure you check your C-peptide. If your C-peptide level is low, particularly below 1, then that means your pancreatic beta islet cells already are burned out, and you may be requiring insulin for the rest of your life. If you are not on insulin, I think C-peptide has some value. I check my C-peptide. My C-peptide is normal. Actually, to give you some example, my insulin level 4 years ago was 21. Now my insulin level is 1 to 2 because I lost weight, I exercise regularly. I completely reversed my pre-diabetes. My A1C 4 years ago was 5.9. Now my A1C runs 5.1, 5.2. So you can reverse it, and I reversed that within like 3 to 6 months. So if you have type 2 diabetes, you can definitely reverse it with just lifestyle changes. Yeah, so Aksha says he's on an oral medication. So if you're on an oral medication, checking C-peptide may or may not be necessary. I would just keep following the lifestyle, and you can keep taking off oral medication one after another. Because if you're on oral medication, typically that proves that you have an adequate insulin secretion from your pancreatic beta islet cells. That means C-peptide level may not need to check. So if you're on oral medication, no need to check the C-peptide level. Did I answer right, Dr. Garg? Dr. Garg,
Oh, yeah, I agree. You know what, in very rare cases, let's say someone's sugar is completely uncontrolled, I have found C-peptide levels to be deficient. And that's the point we know that it's actually type 1. So type 1 can occur in very rare cases in adulthood, whereby the immune system destroys the pancreas cells. So just in 2 cases I've seen in the last 15 years, that's it.
Yeah, no, I think that's a great point. I think it's called type 1.5 diabetes or LADA, where actually adults develop autoimmune deficiency of insulin, and many times, unless you check the C-peptide, and that's an excellent question. I think adults whose A1C is not coming down despite of multiple drugs, sometimes we have to check C-peptide level to make sure that this type 2 actually, matter of fact, is type 1.5. And if that's the case, they will need to go on insulin right away because they clearly have insulin deficiency. So I agree. Checking C-peptide to diagnose type 1.5 diabetes will become very important. That's excellent point.
So let's say if someone is on insulin and they do this plan, they lose weight, they're doing great. So if someone is insulin dependent, they can at least reduce their insulin requirements. And I've seen requirements drop from, for example, 50, 60 units to about 20 or 30 units per day. which is still progress because they're healthier for it, even if the immune system is such that it's killing off the islet cells, the pancreas cells.
Yeah, that's an excellent point. Yeah. Again, we are doing this diabetes seminar live every Sunday at 4 o'clock. You are more than welcome to join again and again. I'm going to keep changing the slides periodically, so make sure that you get some new information. And definitely, you can bring your 1 week of experience. You can bring your 1 week of questions. You can also ask how your diet plan went, any other tips you need. I think I don't mind, Zoom can take as many people as we need to. So I don't mind you come often, maybe once a month, maybe once a week, whatever your schedule permits. So just keep coming back on, and we'll keep discussing together like a team. I think taking care of diabetes, type 2 diabetes, is almost like being a part of the team. And I'm an equal player because I was pre-diabetic too. Even though I may know a little bit more than you guys, the people who are not doctors, but again, we all are in the same lifestyle boat. We all need to work together. We all need to teach each other. For example, I learned from a lot of my patients what works, what doesn't work when it comes down to lifestyle. So again, even though I'm a doctor, I'm a cardiologist, I equally learn from all of you when it comes down to lifestyle. Any other questions? Let me see if Facebook has any questions.
Dr. Shah, I posted my question. I'm not sure who it is.
I'm sorry. What did you say? Here. I hope everybody can read what Dr. Garg is typing in.
Oh, yeah. It says sugar came down to 91. Do you know, Suresh, why did doctor suggest metformin? We can't guess, but you tell us.
So he said your sugar level is high, it could go down, and he suggested do exercise and yoga and go for the vegetables, stop eating the white rice. So I completely stopped eating the white rice. I'm on the complete brown rice, no roti, no chapati, and not eating the sugar anymore. Sugar and potatoes stopped almost 6 months. So then sometimes in the morning, I do check. So then it came to 84. Sometimes it came less, but sometimes I check. Random check after fasting. So then it came sometimes 121. So why this much variations?
So it depends on the A1C, right, Dr. Shah? That
yes,
A1C can be followed probably every 2 to 3 months. And the goal is, A1C non-diabetic is below 6. And, normal is below 5.5. So that's, I can't guess why the doctor's suggesting, but generally in my experiences, we are able to stop the metformin when the sugar goes completely normal, like 5.5 or below A1C. How about you, Dr. Shah?
No, I agree with you. I think many times the reason could be that maybe your glucose tolerance test, if it was done, was about 200, because many times fasting doesn't catch all type 2 diabetic or pre-diabetic. So if your glucose tolerance test is abnormal, sometimes some doctors suggest metformin. If your A1C is above 5.7, and even if your fasting is normal, sometimes you may have a postprandial high sugar, and that's also shown to cause the risk of developing full-blown diabetes in the future. And that may be the reason your doctor prescribed metformin, because we know fasting doesn't catch all pre-diabetic and all diabetic. So, but again, I think for you, your BMI is 25, which is great. But being an Indian American, like I said earlier, BMI of 22 or 23 is probably ideal. So I would say lose about 10 or 15 pounds, and your sugar will be completely normal, both postprandial, that means after eating, and your A1C will go below 5.7. So, but I think knowing you can do it.
Yeah, and there's a very interesting thing that I've seen before, working in an inner city clinic. poor man's glucose tolerance test is to drink a 12-ounce straight Pepsi or Sprite and see what the sugar is 1 hour later. It sounds horrible to do. It makes people sick, but that is the best, simple, cheap, easy glucose tolerance test.
Yes, yeah. I think it's almost like you're challenging your pancreas, see how quickly your sugar can come down. If it doesn't come down properly, then I agree. That's a good way to say it. Yeah.
Yes, sir. Doctor also suggested the same thing. Yeah, you can lose the weight at least 10 pounds. So then we can remove the medication. It will be very good.
Yes, you make a good point. Metformin is often used for a weight loss off the label. In my experience, I did used to prescribe it for weight loss purposes. I didn't see great results because I was not recommending this type of whole food plant-based diet at the time. So bottom line, I think whole food plant-based diet is sufficient by itself. In my experience, metformin is not necessary for the weight loss. If someone's doing the right thing, better than metformin is exercise. And like I said, the thighs are the biggest muscle group. Those are the ones that need attention. And the resistance can be done with incline or resistance cycling.
I think that's an excellent point. Matter of fact, it reminds me, Dr. Girk, that when I was listening to Dr. Sarzai is a neurologist. He has written a book on Alzheimer's disease. He actually says, and he actually has a data from UK, from England, that they did a study on people who had a bigger thigh had a bigger brain. So I think I agree with you. I think, and partly that because people who have bigger thigh, their insulin sensitivity is very good. And because insulin sensitivity is very good, they have less chance of developing Alzheimer's disease, less chance of developing neuronal loss. So I agree with you. I think thigh being the biggest muscle, like sometimes we say walking is good, but if you can do, like Dr. Kirk said, incline walking, or even just some low-level squats. I tell all my patients that even if you are not able to do a lot of weight training, just do low-level squat with a chair, 10 or 15 squats, 3 to 5 sets every other day, and that will maintain your muscle strength in the leg and will definitely improve your insulin sensitivity. So it's about 1 hour. Thanks, Dr. Girk, again for joining. It's a big honor. It's a big honor for us.
My pleasure.
Yeah, and thanks everybody for joining. We'll be start back again on next Sunday at 4 o'clock. This will be on YouTube. The whole episode will be on YouTube in few hours. So if you want to watch it again, or if you want to share it, please go ahead and share it. Again, if you have not watched my 4-hour talk on diabetes, please watch that. You will get tons of answers, including C-peptide, what to eat, and everything else from that 4-hour talk. Thank you again. Have a good evening. Enjoy, be safe, be careful.
Thank you.
Thank you, doctor. Thank you very much.
Thank you.